Hi, welcome back. So today I am wearing the mask actually. So we are passing through a very bad phase, I would say. The second wave of COVID, the tsunami across all parts of India now, and that's why I just wanted to say a few things about COVID actually. So here I am maintaining the social distance, so for the convenience, so I'll be removing my mask here. Okay, so as I was saying that this is one of the most difficult things which is happening now, and such a crisis things. Somebody is having COVID, he or she is not getting bad in the hospitals. There are long queues in the hospitals, and there is shortage of everything, not only medicine, oxygens and other things, and even the medical staff. So much of crisis is going on actually. So here in this situations, I would like to share few of the things, few of the tips. I would say probably this might help you to make it more comfortable in terms of treatment, in terms of so that you can take a decision how to go ahead if suppose somebody is not getting bad in that way. Okay, so first of all, what I'll share is that someone becoming positive, someone is having fever or some other sort of things, become positive. First of all, never be panic. Don't be panic at the onset itself, because more than 90% I would say they will completely recover without any complications at all. They would not have shortness of breath as such, and they might not require actually oxygen at all. So whenever someone is becoming COVID positive or someone's test has become positive, you automatically become so panic. This is a natural tendency of human, that you becomes panic, and what will happen? There is no oxygen, there is no hospital bed, so that's how it's making more complicated, and we get lots of stress up, and thereby you start feeling I'm having shortness of breath, but it does not really happen. So you need to first cool down, that we have these resources and we have to face it, right? And the best way we need to face it, and that's the most important. So be always positive that you will be okay, and at the same time you need to be take care of yourself so that you improve. And saying so, it doesn't mean that you sit down at home doing nothing and then you will improve yourself. I mean, everything will be okay. I'm not saying that. So first of all, don't be panic. Number two, make yourself isolated. I mean, like you're confined to your home, confined to your room, preferably in a single room. Supposedly, if you don't have a separate room, at least maintain a distance whenever you are talking to your family members. A social distancing very, very important. Use the mask and your hanky and other things whenever you are sneezing or talking to and try to wash your hands frequently, right? That's very, very important. Then comes what are the things you can do at home. So I'm not I'm not giving lectures or something, suggestions regarding what are the drugs to be given, which are the drugs not to be given. I'm not talking about oxygen swings to be started and all these things. I'm more importantly, I'm talking what are the things you can do at home to make it much better, so that improves your chances of recovery, and that's going to help us actually. So as I said, isolate yourself and do all these things. Then comes the hydrations. So hydrations I will definitely stress upon, because we people take less fluid. So whenever there is you are having fever and all these things, so you need to take lots of fluid. So it's not necessarily only water, so other sort of fluids you can take. You can take fruit juice, you can take all sort of fluids to maintain your proper hydration. That's very, very important. Okay, and I understand this difficult scenario when you are confined in the room, so you cannot mobilize so much, but still I will suggest you to at least roam around your home, your room, so that helps you proper circulations in your body. So roaming around in your confined room, doing some sort of physical exercises, free hand exercises, is definitely going to help you maintain proper hydration. Then comes is respiratory exercise. One of the very crucial things, one of the important things which is there. There are so many videos is also coming out that how to do exercises and all this thing. Supposedly if you don't have any instrument to do respiratory exercise, so respiratory exercise can be done in terms of like using some spirometer. So a spirometer is a device where we inflate, we flow, and then thereby it helps in expanding the lungs actually. So if you supposedly don't have the spirometer, that is fine. So you can use simple balloons. So try to take large balloons and try to inflate it repeatedly. Inflate by yourself, and then again slowly release it. Then inflate and then release it. This also will help you some sort of lung exercise if you don't have a spirometer is there. Then comes the relaxation exercise. The relaxation exercise in terms of like there are exercises called we used to say in Ayurveda, that's a Brahman Pranayan. Yeah, respiratory exercise is there where you take breathing. So your inspirations you take deep. So for example, you count 1, 2, 3, 4, 5 or up to 4. You take deep breathing and then you relax and take out your expirations. So take out your breath in a longer time. So you have a short phase of intake and you have a long phase of expirations. Okay, so relax, take deep breath and slowly take out. Okay, this is another exercise which you can also practice. Then comes is your prone positioning and then doing exercise, respiratory exercise. So prone positioning is like you're sleeping in your bed or in the floor also. You can use your carpets or other things and then sleeping over your tummy and then doing the respiratory exercise, because when you sleep on your tummy, the part in the lower and the back part of your lungs, it gets space to expand actually. So I'm not going in detail about how to do the prone exercises. So better you can use some pillows below your groin part, and not over the stomach, because this is the part which needs to move also for proper exercise of the lung also. And in prone positions you need to do deep breathing exercises. You can do that one. So these are the few tips for respiratory exercise which you can do, and as I said, this might help you to maintain the proper air entry into the lungs, and then that will help proper healing actually. Then comes what are the other things you can do at home. So other than this is, I would like to say to take more of an vitamin C rich products you can take, like you can take curds, you can take lemons and citrus fruits you can take. This might help you to help in early recovery, because vitamin C have the role of early recovery in patients who are having this sort of respiratory tract infections actually. So these are the basic things which you can do at home, and I really stress upon whenever someone is calling, I always stress upon these are the main factors which is there, because as I said, hydrations and moving around in your room is very, very important. And similarly, like physical activity doing, I understand this is very challenging phase. Confining yourself in the room is so difficult, and so this sort of physical activity and making yourself be in touch with your friends and relatives and other whomever you want to talk, and better to avoid horrific news of COVID and other things, because that will make you more of a negative impact rather than positive vibes. So I'll say rather relax, watching some movies or whatever way you want to enjoy, and you like to suppose reading or writing something, so that can be helpful for you to make yourself relax. So at the same time, so what are the things we need to red flag signs where you need to take your doctor's advice to someone. Definitely you need to take doctor's advice. So some of the things which I would like to mention here also, some of the red flag signs. So at the time, so you definitely need to take advice of your doctors or reach to an hospital. The more one is like your situation is dropping down, your situation is below 90, it's going down, or below 92, and then comes is like respiratory distress. Respiratory distress, you can make out, somebody is speaking but not able to speak properly. Even a sentence he or she is not able to complete properly. That means he has to take breath in between the sentences actually. So that means he is having some shortness of breath. And similarly, you can check in early phase also. Say for example, you are walking in your room for 6 minutes or 10 minutes, and after that you are feeling shortness of breath, your situation is dropping down. Even going to the washrooms or toilet, you are feeling shortness of breath and your situation is going down. So these are the red flag signs that you need to have some consultations with the hospitals and or doctors. And then other things out of this is like, so other than this saturations, we need to talk about, supposedly you are feeling persistent high grade fever for a long time, or you had some weakness in your limbs or hands or leg, or you become unconscious, or somebody is getting seizure, convulsions. So these are things where you need to take care, you need to take advice of your doctors. So probably these are some of the basic things at home which can be done, and might help you. And whenever there is a provisions, you get the chance to always keep oximeter, which will help you, for monitoring your saturations of your blood, and oxygen cylinders or oxygen concentrators, which might help you in difficult times actually. So hope these are the some of the few tips which can be done at home. And at the end, it is always, if somebody has become positive, it's definitely you need to consult your physicians, your doctors, and then the precautions you need to take. And more importantly, as I said, take lots of fluid and medicines as described, as advised by your doctor, and try to be positive. Thank you.